you build this company, what are the leadership lessons that you learned in building a medical tech company?
I think a lot has to do with the team of people you put together. Our teams worked together for over 10 years, so we know each other, and we all have a similar passion and goal for changing health. I think partnerships are going to be essential, and political contest in Washington to become the leader in this space around data.
Hello, everyone. Welcome to another episode of the IWillAim Podcast. Our topic for today is longevity health with Hunter Ziesing. Welcome, Hunter. How are you doing today?
I'm doing great. Thanks for having us on.
You're welcome. Looking forward to our conversation. How about we kick it off with a quick introduction?
Sure. My name is Hunter Ziesing. I spent about half of my career on Wall Street in healthcare, finance, and consumer. Always been a health nut. Love helping people get healthy. I'm an avid cyclist. And when I was 40 to 42, I lost my father at age 67 and 5 of my friends to various cancer-related infectious diseases, largely that were preventable. And my career had run its course, so I left and started a fundraising effort for large cancer affiliations associated with the Lance Armstrong Livestrong Foundation. I did that for 15 years.
Wow. Now we want to jump into the topic about your company, Longevity Health. What inspired you to co-found a company like Longevity Health?
So, as I mentioned before, I was always interested in preventive health. Livestrong did amazing things for cancer survivors. I was more for leave the survivors alone and focus on the root causes and some predictive measures to get in front of infectious diseases. And then after I did that for 10 or 15 years, we raised several $100 million for cancer centers around the nation. I went to work for a company called Paceline, which is paceline.fit. And it's an app. It's a really cool app that tracks your heart rate. You wear a wearable device, including a Fitbit, a Garmin, or a Apple Watch, and it tracks your heart rate. And each week you would elevate your heart rate to 150 minutes of elevated heart rate. And elevated heart rate could be just, going out for a brisk walk. You don't have to go run a marathon or ride your bike super hard, but just elevating your heart rate. And incidentally, the World Health Association and the American Heart Association recommend for a healthy adult that you elevate your heart rate 150 minutes each week. So that's how we came up to that. And we provided an incentive for as little as $1 a week just to go elevate your heart rate each week. And then we provided rewards such as Amazon gift cards and partner rewards. And what was fascinating about that was how it drove behavior. People would rush on Sunday afternoon when they were at 130 minutes outside to walk the dog or go for a short run to get to that streak or 150 minutes. And then it would reset to 0 each week. So I learned a lot about data, a lot about driving behavior, gamification around health. And that caught my attention. One of the challenges, Will, was about 90% of the people that use the app were already healthy and it's following a health regimen. And they thought that was a cool idea. One of the biggest challenges that we're trying to address with my new company, Longevity Health, is to not only drive behavior, but try to help people use their own data in addition to their heart rate data, such as functional testing and gamification to motivate people that are not healthy, that need to become healthy.
That's an interesting fact that you said 90% of your users are already healthy and the 10% are not, when one of your key goals would be to get the non-healthy people to use your app, right?
That's correct. But there's a lot of challenges with that. One, our food supply sucks. The drug companies are taking advantage of that. And the food companies are poisoning us. And a lot of people just don't have the tools or the access to really focus on their health and look at all their data and do the proper testing needed to sort of stay in front of infectious diseases, obesity, and things like that. So there's a big affordability right now, such as our company, which is, by the way, longevityhealth.me. We run a high-end concierge program that does comprehensive testing and analysis. You get a doctor. It's a great program, but it costs $11,000 a year. Not everybody can afford that.
Yeah. How do you define longevity?
Oh, longevity really isn't about living longer. It's about living better, health span. And if anybody's read Peter Attia's book, you've seen his chart on health span and lifespan. And the fact is, most Americans have a crummy health span. We live a pretty unhealthy life until we're about 60, and then the wheels come off the bus. And it's largely driven by proper diet, improper diet, weight gain, and the last, um, you know, 10 years of our life can be somewhat problematic, which incidentally costs the government and with Medicare trillions of dollars at end of life care. So health span is just, being happy, having a healthy, fulfilled life as opposed to dealing with infectious diseases in and out of the hospital, whatnot, or dying, what I call dying slowly. I want to live till 102, and I want to literally walk out the door and pass away. Sadly, my father-in-law passed away at 94 earlier this year, but followed a pretty serious health regimen his whole life, and more or less took an Uber to the hospital and passed away the next morning.
Wow. Sorry to hear about your loss. What's the mission and your vision for your company over the next 5 years?
So our mission is to change the nature of preventive health at scale by providing people the tools and the wherewithal to become and live a better, active, healthier life. The vision is to use consumer data and AI to help reduce the cost of that, and to hopefully influence policy leaders and insurance companies and self-insured companies to allow employees and individuals to do more functional testing besides just going to the doctor every year and saying, hey, Will, you've been eating too many biscuits, your weight's a little high, you're predisposed towards this or that, and then you follow it for about a week and then you're done. So that's sort of really the vision. Right now we're doing an amazing job with this product we call the Billionaire Bundle, which is $11,000 a year, and it's a full clinic. And I'm sure you've read about, some of these high-end longevity clinics. Peter Attia's costs $200,000. I think there's a waiting list to get in. Others are largely bricks and mortar clinics that are $20,000 to $40,000 a year, and they're wonderful clinics. We just happen to do it much cheaper because we do it all online. We partner with all these wonderful testing companies, and we do 6 tests, including a DEXA scan, which is bone density and visceral fat. We give everyone a glucose monitor. We do a sleep study, a gut biome test, a blood test, and one other that's escaping my mind. And then we give you a full longevity board, including HIPAA compliant. It's all HIPAA compliant. So you get a physician, and one of our lead founders is a physician at UCSF. We give you a concierge. We give you a clinician, a dietitian, and an exercise physiologist. And we develop a plan for you based on your individual needs. We sometimes change the tests around a little bit by the individual. Some people want to do RNA, DNA, genomics, but those are the 6 tests that we're focusing on right now. And they will change, and they'll change based on the individual. And then we follow you throughout the year. Unlike many bricks and mortar clinics that wine and dine you for a couple of days and send you on your way, we retest every quarter, mostly the blood test and sometimes the DEXA scan, to determine if you're changing your biomarkers. And then we give you a whole coaching plan, and we stay with you. We give you a Slack channel or email or text to access your executive medical board 24. It's an incredible value. It's an incredible product. We're growing that business. There's a lot of demand for it. But again, it's just not scalable, and it's not affordable for the masses.
So what's the biggest challenge you face in getting people to adopt your product and services?
So the biggest challenge for the $11,000 product is it's not just for the wealthy. And we've done some direct marketing to people that could afford it, but it's really a matter of finding people that want to stay in front of their health. It's usually someone that's had a health scare or family health scare, and they're worried about their own health. And those are hard to find. We do some marketing through Google when people are searching for longevity doctor. So that's the biggest challenge, is finding those people. When we do get them on the phone and they converse with us, we've had a fairly high close rate, but it's not easy to find those people. People are largely waiting until after the fact.
Yeah, no, often it's too late too.
Exactly.
I think you have this market for your 11,000 product. Are you thinking about creating sorts of a products for the masses at some point?
Yes, we've been testing an AI doctor. I could actually demo it for you right here on this. We can call it. It'll call me back and talk to me. We've been testing that. We also have a platform in partnership with a company called Healthy, which is similar to Epic, which stores all your HIPAA data, and you can download any testing data that you've had done. And we can also order tests, and the AI doctor will analyze your data and then make recommendations. It's pretty incredible. We tested it. We're still skinning it out and making the user experience a little bit better. You asked about the biggest challenges. There's really three right now. AI, as much as everybody loves to talk about AI, is not fully ready for prime. It still hallucinates, it makes mistakes, but we need to train these LLMs to really understand it. We also need to train it to have a better bedside manner like a doctor. And then the regulatory environment is not fully ready for AI yet because eventually it'll prescribe medicine and make accurate recommendations, but it's just not quite ready for the regulatory environment in Washington, D.C. It's coming. And then the third thing is that consumers aren't fully ready for AI yet. You still need a human in the loop. And I analogize it to driverless car. In San Francisco, when you see a Waymo,
Yeah.
you'll probably walk in front of it and not worry about getting run over. Whereas in the rest of the country who haven't seen Waymo, when you see a driverless car, you're kind of going to run for the curb. So people still want a human in the loop, and there always probably will be a human in the loop. AI is only going to take some of the functionality cost out of the equation, and hopefully it will increase the accuracy. And when consumers are empowered with all of their data, they're more prepared for their physicians when they need a procedure done. But consumers aren't fully ready for it. So what we're developing now is several products, which we call AI with human in the loop, and they range from $200 to $400 a month that includes some testing. So that's the next phase. And when the market and consumers in the regulatory environment are ready, our dream goal, Will, is to launch a $10 a month product paid for by consumers or by your employer or even your insurance company or Medicare, where that houses all your data, uses your data to make recommendations. And then the real $1 trillion play is to gamify it with an app using social media, the likes of, Facebook, Strava, other mods like that, to get people sort of motivated, and then build a reward system into the app so people will have some incentives to follow a better health regimen.
For that product that you're talking about that you mentioned, it's about $220. What's the timeline for that?
Which product?
The $220 product. The one before, and yeah,
the $10 or the $100 to $200 product?
The 100 to 200.
We're just starting to test that right now. So then that's right now. We're in beta with that right now.
Okay. When do you think we'll hit the market?
I would say early January.
Okay.
We already know it's going to be successful. We just don't know what people are willing to pay and what levels they want to pay. Do they want us to pay for the testing? It's going to cost them more money. Do they want to download their own testing? How much testing do they have? So we're just trying to figure those things out, but probably early next year.
Well, I'll be looking forward to that one. What do you see is the greatest impact for your company to the marketplace in the next 5 years?
Well, it's more of a 50-year plan than 5 years, but really the goal, my mission is to change the nature of preventive health at scale, to help people garner the tools and information to take advantage of their own health, to change reimbursement so that there's many great testing companies out there are reimbursed and directed by their doctors for these functional tests. And the long game is to increase health span in society and reduce cost for America, for our healthcare system, particularly around end of life.
Well, thank you for taking this very ambitious step to help the consumer and also help them own their health. I think that to me is very important. I have a Hume, I wear it, and I measure my body fat.
Yeah, you mentioned, what are the challenges? I just thought of another one.
And I have my Apple too, so I.
And you sleep. Where's your sleep ring? Where's your sleep ring?
I don't have sleep ring.
The challenge right now, another big challenge for us, is that we feel that you really need more longitudinal data than single test data. And
yes,
I think $8.5 billion over the last couple of years has been raised for around functional testing, hyperbaric oxygen chambers, gut biome tests, blood tests, which have somewhat become commoditized, and that the consumers are being fed, which I might call Nick medicine. This is the test du jour that's going to change your life. And I'm not sure what they're after, whether they're just acquiring consumers and they plan to layer in other forms of testing and health recommendations, but most of them do not seem to be clinically driven. It's more, take a test, buy supplements, right? Here's a blood test. You need more supplements. So I think consumers right now are a little bit confused, but it's also a tremendous opportunities for us because we think that testing, as great as it is a race to the bottom, and it's going to become more commoditized, and that'll only bring the pricing down for consumers, which will make it more reimbursable. But you got to have more data than just a blood test.
And you also need to have the trend, right? Like you said, longitude data of saying how things are quarter over quarter, because one sample size isn't good enough. You sometimes doesn't drive the behavior to change. But if you see you have a trend over the last 5 quarters where you are and things are going south, you could make that decision to say,
that's correct.
Hey,
and some of the functional testing companies, the blood test companies, they are doing that, but they're just largely using blood only.
Yep, I agree. Our next question for you, as you build this company, what are the leadership lessons that you learned in building a medical tech company?
Well, I think a lot has to do with the team of people you put together. Our teams worked together for over 10 years, so we know each other. And we all have a similar passion and goal for changing health. I think partnerships are going to be essential, and political contacts in Washington to become the leader in this space around data. And what I mean by partnerships, rather than raising hundreds of millions of dollars to go out and acquire consumers for this application, my goal is to get the likes of Microsoft, who tried this, by the way, in 2016 with a business called Health Vault, to consolidate consumer data. They were a little bit early. There was no data. They didn't gamify it. They didn't really put any social element around it. And in fact, Don Brown from Lifeomic wrote a great article about it. I'll send it to you. But I don't think Silicon Valley, people say, well, Apple's going to do this, Google's going to do this. I mean, I think the only ones that are probably going to do it or doing it right so far is Bezos at One Medical. That I won't compete against. So I'd rather partner with One Medical. We're just $10 a month. If you want to use One Medical for your doctor, don't use us. Don't use our doctors. Use One Medical. Recently in DC, a bunch of the tech titans were there meeting Microsoft, Google, Apple about giving and consolidating consumer CIS platforms for consumers. So I think they're more interested in housing the data than they are the applications. So, yeah.
Housing the data is only one step of the entire equation, right? And they need to do a good job protecting the data too.
That's a challenge. People my age and up are very weary of sharing any of their data. And, we had a big security data breach earlier this year that shut down the whole healthcare billing system in the country. And that's a concern. But the younger people, 30 to 50, are very open to sharing their data. I mean, they're used to it.
Yep. True.
And if I can do something with your data to help your life, I'm more apt to share my data. Just aggregating data in of itself is not a business, but doing something with that data to help people is.
And that's where I think AI could help, right? The trend analysis, pattern recognitions, all of those could be done by AI faster.
Correct.
Yet to me, that's where AI comes into play. That's what I always said. It's human plus AI. Human eventually make the critical decision, but you use AI as a tool to enable you, similar to computer.
We call it a doctor with human in the loop.
There you go.
And there's always going to be a human in the loop. Look, think about down the road. Eventually, we could tie this into your provider, so you could act your urologist, your general practitioner that you can still use is tied into it. But you're not walking in there with a bunch of tests you had done and saying, hey, what do I do with this doc? He sees it all. It's kind of like walking into a ski shop with your boots, your bindings, your poles, the jacket you bought on Amazon, and saying, hey, mount my bindings. And oh, by the way, the zipper on my jacket's broken. Can you fix it? Doctors hate that. So ultimately, your check engine light's going to come on, and it's going to detect something in your health or your health history or something going on in your life, and it's going to recommend a procedure. Then we either refer you out or you go to your primary care physician or your specialist for your procedure.
I like the concept of check engine light coming on. Imagine if you have your app and a check engine light does come on and tell you like, you got to go do this and do that, right?
Yeah, we could have some fun with it. You could set the parameters to like serious or gamify it and make it fun. Like I said, hey, Will, lay off the biscuits. We just noticed you traveled somewhere and you didn't eat well. But you can do some amazing stuff. Like you can, it knows your dietary habits and you could be vegan, say. And when you go into your local grocery store, we could have partnerships with major food companies that provide healthy foods around your diet. It could develop a plan for you and say, oh, by the way, on aisle 6, you can get 30% off our products. So it's driving behavior incentives.
I think ultimately that's really where the value add is happening to your consumer. I think when you get to that point, I think that's your company's going to be really big. You're going to be really popular. If you have a message for my audience about your company and your product, what would that message be?
Well, right now, if you can afford the full program, I'd highly recommend you take a look at it. Again, it's longevityhealth.me. You can schedule a 15-minute consultation for that. And eventually on the website, we're going to put up access to this beta. So we'd be looking for some beta trial users. It's around $200 a month. You can spend up to $400 a month with some testing. You don't get the full services of the, a full doctor, but you get everything else, the clinicians, the dietitians. And my message would be, if you can afford the full program, go for it. If not, and you'd like to try our beta, we'd love to have some people try that. And that should be up in about a week or two.
What's the best way for people to reach out to you?
My personal email is hunter@longevityhealth.me, or just go to our website, longevityhealth.me.
Thank you, Hunter, for your time. I really appreciate you being a guest on my podcast.
Awesome. Thanks, Will.